Good evening, all. Thanks for tuning in. We start with something that could affect every single one of us at some point in our lives: organ donation. Right now across our country, more than 100,000 people are waiting for a kidney, a lung, a liver, a heart, any organ that can save their life. That includes 2,300 people in Minnesota and the Dakotas, and every 9 minutes, a new person is added to the national wait list and the list here at home. And even though there are thousands of people signed up to donate, LifeSource says only about 1% of people can give when they die, and a big reason is speed. Recovering the organs and getting them to the people who need them, all within a certain window of time, is a tall order. But there is hope. A new partnership is trying to get help to those organs, to getting those organs, to people faster. And John Croman is here to explain. Hi, John.
Hey, Jana. These donor care units exist in other parts of the country, but the two being launched here will be the first ones in Minnesota. Instead of moving a donated organ to where it needs to be, they'll be moving the entire donor on life support. Pinwheels planted at the University of Minnesota, symbolizing donors, like the one who saved little Keegan Johnson, who had literally turned yellow waiting for a liver transplant.
So on November 3rd, Keegan went into surgery. That was the scariest day of our life.
Keegan's mom, Heather, appeared at a ceremony today announcing the M Health Fairview has launched a new donor care unit.
And Keegan is 14 years old now, playing baseball and going to summer camp, and just so active and so healthy.
The University of Minnesota Medical Center and the Mayo Clinic are both partnering with LifeSource to create units that will recover organs directly from the donors' bodies in the same hospitals where the transplants take place.
This really is an effort to centralize organ donation and kind of put the expertise in one place and bring the donors to the donor hospital versus taking the donor team and going out to a hospital where a donor is.
2,300 people across Minnesota, North Dakota, and South Dakota are waiting for a life-saving transplant. So the idea behind this is when we have better processes, higher quality, higher efficiency, we'll be able to help recover more organs for transplantation.
LifeSource will continue to work with hundreds of hospitals recovering organs and placing them with matching recipients, but the idea of moving donors' full intact bodies could change the transplant landscape.
So once they're authorized for donation and they are declared brain dead, then that's when we would initiate the transfer process. So they will stay on a ventilator, they will stay on all the medications so that we can really ensure that we've got organ health management and a smooth process for that donor.
This is a way to help maximize the number of organs that can be transplanted per donor. Some ways it's the care of the donor. So again, expertise on how to care for someone who's brain dead, who's waiting for organ donation after they've consented to do that or their family has.
This will help guarantee higher quality organs and lower the waiting time for the families of the donors.
It's hard to lose their loved one and then wait maybe 24, 48 more hours before we can move forward with donation. And that process is so critical for us because, again, we're working on organ health and then we're also working on placement. So placement and finding the right match can take a decent amount of time. And so we believe with this, we really can shorten that time.
The two people in that story were Dr. Andrew Adams from the university and Kelly White from LifeSource. Now, the mother you met at the start of the story, Jana, Heather, she reached out to the parents of the teenage girl who was the donor for Keegan's liver, and the two families did eventually meet. The donor's family has been happy to see how well Keegan is doing.
It's always special when they can keep that relationship up. John, we know Minnesota is always kind of a leader in healthcare. What kind of took us so long on this one?
I don't know. That's a good question. I think it's just things have been so decentralized for so long, and they just had a lot of national studies saying this is a better way to do it.
Right. Okay. Thanks so much, John. We appreciate it.